Okay, so the tuberculosis epidemic, 1500s to 1700s. Tuberculosis is also a bacterial disease. Symptoms are damages to your lungs. You need that to breathe, so you need that to live. Area was common in Europe, and then it spread to the Americas when Europeans came here. Social conditions, well, the main tuberculosis epidemic here in the Americas hit Aboriginal populations because they had no previous exposure. So then once we had overcrowding in boarding schools, poor air circulation, lack of sanitation, and poor diets, these kids just dropped dead left, right, and center because of tuberculosis. We had taken them from their families, put them in these horrible schools, gave them a horrible disease, wiped a bunch of them out. It was terrible. The impact were that patients were sent to special treatment facilities called sanatoriums, and then many were put up for adoption after they got healthy, okay, rather than returning to their families. Some lost contact with their communities altogether. It was a very sad, a very unfortunate time in our history. But tuberculosis wasn't just, back in the 1700s. It's something that is even affecting us today, especially when it comes to multi-drug resistant TB, which is something that we're going to talk about in a later lesson.